Hey class, my name is Jamie Zimpridge and I'm enrolled in the Bachelor's of Health Science program. Almost there. I've been a respiratory therapist for 8 years and I've experienced many patient care scenarios that involve ethics and patient safety. So I do have quite a bit of knowledge on that, but in this class I've been learning a lot more about research and how that ties into communication and the ethics and all of that together. As a respiratory therapist, we have the duty of making sure patients are safely breathing and assist them with helping them breathe better. We see a lot of scenarios of end-of-life care and, a lot of moral situations that we're placed in to help patients navigate the best for themselves, essentially, and help the family aid in that as well, because, a lot of times they all have different ideas of what the patient wants, but the patient knows what they want. So that's a big part of our job. Today, I'll be talking about the ethical issues in research and, surrounding in communication and how human subjects are in healthcare research. This can involve direct communication with all the parties involved. The subjects, the healthcare professionals, the researchers, they all come together to aid in finding new ways to deliver healthcare with the new technologies and medicines. And the only way they're able to do that is through research. So first we need to talk about the principles of scientific communication. These principles involve knowing your audience, presenting the material in a clear manner, balancing honesty and efficiency. In research studies, this can be a challenge, and allied health professionals have a professional responsibility to ensure communication is present. Being able to communicate with the audience is key for a successful scientific communication strategy, and the patient must be directly communicated with throughout the process. Ethical implications and the connection to human research as it applies to healthcare professionals is where the patient can be in some kind of risk or potential harm from the study. And even the participants, researchers, bystanders can be in harm from this study. So there can be some ethical concerns on that. And in human research, they use things like informed consent, beneficence, truth-telling, deception. They use these strategies to help communicate and make sure the patient knows what's going on, and like informed consent. The patients must voluntarily agree to take part in the research after being fully informed about its purpose, methods, risk, benefits, and alternatives. This gives a chance for patients to be involved in their decision-making process for their care. The more involved the patient is in their care, the more active they are in taking care of themselves. And beneficence, when you can be seen as doing the best for the patient or acting for the patient's best interest. If it's not for the patient, if it's going to be causing more harm than beneficial, then they don't need to be doing the study. They need to be communicated to about that. That's very important. Other healthcare professionals need to know what the risks are for each patient that's as a subject. This can help ensure a patient's best interest is kept in mind throughout the process of them being a human subject. And if the patient seems to be not as good a candidate or is in risk for undertaking the study, the healthcare professional is required to stop the process for the patient. The patient's safety must be withheld at all times. Telling the truth to the patients. This is an important one. You have to be honest with the patients of what they're going to experience, what they're going to feel. Is it going to help their condition? Is it, good for preventative? Like all the things that the research is providing for them, they need to understand that. So communicating with them effectively is key to making sure that, their best interest is still in mind. And being honest with the patient is important because then you're maintaining trust. You're allowing the patient to see that their best interests are in mind, that you're not just there for just the research. A lot of times they try to use deception to deceive the patients into consent without really telling the patient the full story of what the research is and, how the data is going to be. And that can be very controversial of it's not okay. I've seen some literature where it is okay. It really just depends on what the study is and what these deceptive natures are. If it's a very small thing, it may not harm the patient, but if it's a very big lie, then it clearly is not acceptable to be in that study. A lot of studies and stuff have the institutional review boards that are there to make sure these patients are safe, to review all these things, to make sure that the researchers aren't just using these human subjects and, potentially causing them harm. So all these things are, considered potential risks of research, even emotional distress from it. They want to minimize risks to patient care. And a big part of that is keeping communication. It even requires respect for human dignity, integrity, privacy. They can't be telling everyone what's going on in the study. They can't be telling patient information. There's a lot of things that have to fall in line for this to be a proper study. And, they want to protect these vulnerable populations and strive for all cultures and communities. And they don't want to, they want to produce a proper human research with proper data that isn't, have any kind of swaying there back and forth from what the info is prior. So as an allied health professional, as a respiratory therapist, displaying formal writing correspondence to communicate with people involved is very beneficial for the study. Even having some kind of secured website that only the participants can log into to help them understand what's going on through the study, making sure they have constant communication from the researchers, the allied health professional, and just really making sure that their safety is key is definitely a challenge for this human research. And, as an allied health professional, it's your job to keep the patients safe. These ethical guidelines are there to make sure that patients are taken well care of and that this research is going to help people in general and not harm them more. So aiding in the patient safety process and communication, and that all ties together with research. And yep, that's all I have today. Hope you guys enjoyed it.